Hello, everyone. Thanks for joining me. My name is Andy Biggs. I'm Congressman from Arizona's 5th Congressional District. It's my pleasure to be joined today with Dr. David Samadi, who's very enlightening, has a great personal story to tell. Came to the United States from Iran in 1979 when he was 15 years old with his brother who was 12 years old. And now they're both surgeons. He's got over 20 years of experience in urology and is considered one of the best prostate cancer surgeons. He is dedicated to compassionate and successful prostate cancer treatment. And currently, Dr. Samadi acts as Director of Men's Health at St. Francis Hospital in Roslyn, New York. He and his team of professionals help men of all ages overcome their urologic issues with the latest treatments and minimal side effects. He developed the smart surgery technique in order to achieve his main goal of completely removing the dangerous prostate. And if I'm not mistaken, that's bringing robotics to prostate surgery, and that's fantastic. He's a member, Dr. Samadi is a member of the American Urologic Association and the AMA. And Dr. Samadi frequently presents his clinical research at medical conferences as a subject matter expert nationally and internationally. And I'm sure that many of you that are watching this have seen him on TV. He is a brilliant surgeon and doctor, and I thank him for joining me today.
Thank you, Congressman, for having me. It's a pleasure to be with you, and thank you for that kind introduction. I think we are at a very special moment in America where our freedom of choice is at risk. Our liberty is at risk. I came to this country, and I have been here for over 37 years. I can tell you that I love this country, and I'm speaking on behalf of millions and millions of people that came to this country for the big dream. You can look at me as the true American dream, and we've done it and we've made it. I'm in a place where I can save so many lives. I do it with heart, and I do it with passion, not for any other reason. And this country has done a lot for me, and I will do whatever I can to protect her. When it comes to medicine, you never have to worry about me talking about politics. Whatever I say is because of what I truly believe. I read the studies, I interpret. Maybe my interpretation may not be as yours, but that's what makes medicine so special, that we can interpret the same scientific data and have a discussion. We need to learn not to attack each other so fast. The nerves are high, everyone is so sensitive, we are polarized, but don't bring politics to medicine. We have a man in the White House that wants to get us through this pandemic. We all need to get united. The enemy is not on the right or on the left. The enemy is the virus and the people who send this to this country. This is the time to unite and win. And I really appreciate the time that you're giving me to be with you. And it's an honor.
Well, thanks. And I'm behind you too. And I know that it takes a great deal of courage to just speak the truth today. I've talked to a lot of doctors just because first of all, when this was first breaking, I wanted to know more, right? So then you find out more, and you find out things that really are being suppressed, and you go, well, let's keep going. And then as we see, I mean, there's nothing reprehensible or controversial. Should not be anything controversial about what you said that you got basically deplatformed for. I mean, there's nothing there, and yet somehow they came after you. And I've had doctors tell me, Andy, I'll talk to you off the record, but I won't talk to you. I won't give you an interview because if I do, I'm going to be deplatformed. They're going to come after me or something like that. I've got doctors who are friends that have prescribed hydroxychloroquine, and they're before their state medical boards for doing that. And that's a decision I think really kind of belongs between the doctor and the patient. One would think, but
correct.
But now it's in Arizona, for instance, it's illegal. It's effectively a criminal offense if you are prescribing hydroxychloroquine as a doctor, and you just go, why would that be? Why? I mean, seriously, why would that be? I am a big believer in the right to try. Legislation that we got through here, which says if if you're fatally ill, terminally ill, maybe what you should do is get an opportunity, especially if a drug's cleared phase 1 of FDA. I mean, what you should be allowed to maybe have a shot at it to see if it will prolong your life, make your life better, ease your pain, whatever. And that should be between the doctor and the patient.
Agreed.
And here we are with hydroxychloroquine, which is, as you know, and I'm not telling you anything you don't know already. That's been around for decades.
Yes.
And the if you look at the site itself, we're talking. It doesn't indicate that there's additive effect if you're already taking some other medication that might cause an arrhythmia. It doesn't add to that. It seems to me like they've adjudicated that this is a safe drug over time.
Well, look what happened. You had Neil Cavuto that went openly on Fox News that said, if you take this medication, and he's pointing to the camera, says, this will kill you. So you have Anchorman, and I know all these guys. I've done hundreds of interviews with them. And these guys are now becoming professors of infectious disease and internal medicine, acting like, don't touch this. You have Sanjay Gupta, who is like every night pounding this with his buddy AC360 about all these medical conferences they have on CNN. And it's like a lecture room, and every night talking about the fact, yes, there are many studies shows that people have actually died from this. Well, where is the data? How many people have really had cardiac arrest? I mean, people have been taking this. In India, this is one of the main reasons why because it's such a dense population, much worse than New York, they're all on this medication and they're doing well. Now, I'm not suggesting that this is the cure. Right. I would never say anything like this. We don't want to come across like we're losing it, but I think it should be an option. That's all I'm saying is that give the doctor and the patient the option. Let them have the discussion. And in medicine, you look at the risk and benefit. If the risk outweighs the benefit, that's not a good medication for you. You get a second opinion, you move on. This is what happens every day. I suggest to you for robotic surgery, we should remove the prostate. If you're not happy and we go through all of that, then you go for radiation, you go other things, but it's about choice. And when you start shutting down the accounts and you're removing videos and you turn people down, what is going on to our country? And that's what I wanted to talk to you about.
Yeah, right. So, yeah, right. And that gets back to what you were saying when you were censored. And I mean, I've read what you've written, and I think it's very measured. I mean, and the things you said were very measured. I mean, you said hydroxychloroquine may be helpful in the early stages before somebody gets really sick and goes to the hospital or something. Well, if you're not even saying absolutely helpful, you say just
that's correct.
It may be helpful, and so why would you censor that? Why would you suppress that? And we see that, and you're right. Yesterday, we didn't get at that, and I think some of my colleagues were getting at that when they were talking to the big tech guys. But and some of them brought up some specific instances, whether it's the Gateway Pundit being censored. But you get censored for saying what I consider to be very measured, modest advocacy of patient-doctor rights.
And from what I understand, and there was an article that came out from Newsmax, I don't know this lady who they interviewed, who's a PR agency, and she's basically saying in public, for a doctor like myself, I should not be talking about two words, COVID, because that automatically sends a signal to all the social media, and hydroxychloroquine. The minute I mention these two words on any of these tweets, that will automatically send a flag and will bring the account up. So I was talking to a friend of mine. I said, I'm going to be like talking about the weather and forecast and the wind blowing from left to right and chance of humidity as a doctor. I'm going to predict the weather from now on. We're having some fun with this. So, I hope and I'm sure you can make a big difference. We need to stand up right now, because if you're going to shut down the doctor, then what the hell is this MD letter, 2 letters after our name is good for? Give it to all these celebrities. Sean Penn is making a decision who should get this medication, and Don Lemon. Let them decide who should. We're losing the battle, and I think we need to stand up.
Right. No, you're right. We have to continue to fight and stand up and be heard. I mean, as somebody like me, I'm not a doctor, but I can read this stuff. And,
Yeah,
I look at like a doctor from Yale, Dr. Frisch, right? Or Dr. Risch, and you look at him and you say, well, what has he said about it? Well, he's been very much more proactive than you have.
correct.
And
Absolutely.
they've tried to come after him. And it's this type of thing is just, it's actually should terrify all people who love freedom. And you, having been in Iran and experienced the revolution, this has got to be unsettling to you at best.
Big time.
Hey, Doctor, while I've got you, I wanted to ask you about two important things that you've written about as well, and I wanted your reflections on this. Excuse me. One is the study out of the Henry Ford Hospital. A lot of people, I think, overstate what their conclusions were, and a lot of people try to ignore it. But I think I wanted your opinion on your interpretation of what you saw in there, because you mentioned it in one of the pieces of yours that I've read.
So this particular study, you have to understand all of these are observational studies, but this was a positive study toward hydroxychloroquine. And then what they realize is that when this medication is given at the early stage of the disease, it can actually potentially reduce the risk of death by almost like half. And this is significant. The whole idea behind hydroxychloroquine is that, and those studies that actually showed there's no real result with this medication, is because the disease was really advanced. The inflammation and what we call cytokine storms already have taken over the organs. And of course, not only like this medication is not going to work, probably remdesivir is not going to work. And that's when we get into trouble. Anything that can be done to save these patients from going to the hospital, anything that we can do to shut down that storm, that inflammatory process that's going to get started, whether it's vitamin D or zinc, vitamin C, hydroxychloroquine, these nebulizers with steroids. Some studies are suggesting that maybe even steroids, dexamethasone, may be helpful. Anything we can do to like shut it down at the beginning before this cycle takes off and start becoming active, and then put the patient to the hospital, that would be very, very effective and can save lives. And the immune system can fight back. So you're basically helping the immune system by reducing some of the bad guys and controlling them. And in that study, it seemed that hydroxychloroquine plus Z-Pak and zinc was quite helpful. Part of the reason why people take antibiotics is because the bacterial pneumonia can also get them. So you may be going after the virus, and then the pneumonia can actually get them, especially in people who are high risk, multiple medical issues, diabetic, obesity, cardiac issues, older people. Men are more at risk. Obesity is a big risk, and African Americans. So that was a positive study. But mind you, these are all observational studies, and they are not the typical randomized, blind, control blind perspective that goes on for many years. We have a pandemic, we need a result, and whatever medication that we can use to reduce the risk of death, that's what it was. And that's why I said we should look at this study seriously. On the other hand, I was one of the first people that came against the Lancet study. And I spoke about Lancet and I said, look, there's a lot of flaws in this study. I studied it very well. I did a couple of interviews on this. And I said, this study should be retracted because of X, Y, and Z. And 2 weeks after, that study was retracted. That study was a big problem because, number one, it was published in a well-known journal like Lancet, and also FDA and WHO put a lot of weight on this, and the media ran with it. And that was like the end of hydroxychloroquine. Let's not look at this medication ever again. I think this medication has been politicized. I think this medication has gone from being a simple medication that has been used for years for arthritis, for lupus, for our army, for soldiers, for people that go to many African countries and they use this. And I've gotten hundreds of emails from patients that talk about the fact that they've been on it for weeks, months, and years with no complications. Is it possible that someone out there can have cardiac arrhythmia? Sure. Is it possible that someone can have complication from this? Absolutely, but not to the point of this scare and panic and, my God, if you take this, you're going to end up having a massive heart attack. Stop this already. And the doctors that are talking like this, they know better. They know about this medication. Now, is it a cure? No one is ready to commit to that, and nobody should talk about cure for coronavirus with hydroxychloroquine, because that doesn't make sense. But what I said was that if, let's say, vitamin D or if vitamin C, I don't care what you call it, or hydroxychloroquine, in the time of pandemic, when you have people dying, and remember, this was going on about 3 months ago when they predicted 2 million Americans in a body bag. So you have the President of the United States standing on this task force, looking at Dr. Fauci for guidance, looking at the other doctors. He's running the country. He's running the country. You're the advisor, the medical advisor, and you come up with this model that shows 2 million Americans are going to be dead. And you have a medication in front of you that maybe, perhaps, possibly could help. Any person with the right mind is going to say, you know what, let's give it a shot. Because what do we have to lose? It just happens that the side effect profile of this medication is low, that has been around for many decades, that there are some studies that suggest it can save lives. And what I said on my tweets and other places and articles that I've written is, I'm on the side of life. If we can save one life with this medication, I'm for it. I'm in the field of cancer surgery. I deal with cancer. My enemy is not the Republicans or Democrats or right or left or white or black. We love everybody because we're in this business of saving lives as a cancer surgeon. And that's my attitude when it comes to this virus. The enemy is the virus, not the Republicans, not the president, not the Democrats. We need to unite. We need to stay together because this is, at the end of the day, we're all Americans. And that's what I believe in. And that's what I said. Why they start shutting down my Twitter account, why they take videos out of social media and Facebook and Instagram. This is so idiotic, and there's really no room for it in America.
Right, and you're exactly right, man. I wanted to, as you're talking, I wanted to stand up and cheer because this should never have been politicized. This should have been something that we actually could have come together as a nation on this, and I wish we had. Another issue that you've written about, and this is critical in the country today, and this is on schools and children in schools. Is it safe to go back? And I think you would perhaps you'd agree with me on this. There's so much panic in our society that panic is an emotion, and trying to deal logically and say, well, you know, we're dealing with risk here, and let's see what is the risk profile, number one, and number two, can we mitigate the risk more? But how do we get kids back to school? And is it riskier to keep them out of school than have them go to school? That type of thing.
It's an excellent question. That's right, and I think I agree with you that in any kind of pandemic, it's always the panic and fear and hysteria. This is part of the DNA of any pandemic. You look back to 1917, it's the same exact thing. And when you let that get ahead of your life, and I'm not saying that we should be careless, I'm saying like be aware that there's always, oh my God, there's always, oh my God. We've had friends that they have lost their lives. We have people and we've seen that they have died from this. So there's this oh my God factor. But don't let that oh my God factor get ahead of your common sense, science, facts, data. What's the example of opening up the schools? Well, have Europeans done this? Has any other country like gone through this ahead of us that can set an example to say what happened to their kids? And if you have example of over 20 countries in Europe and many other countries that shows after opening up the schools that the children's risk of getting this virus is low, the risk of transmitting this to adults is low, the risk of dying, that K1 to K12 is low, then why politicize this? And the reason why we should not politicize this is because this has nothing to do with the president, should not affect the election. This has to do with our kids. There are studies that suggest that when people are in lockdown mode, the opioid use, drug addict, suicide, spouse abuse, child abuse. People get crazy. They have lost their business. They have lost their savings. Millions of people out there don't know what's going to happen tomorrow. That gets them crazy. That gets them to affect their families. So the risk of lockdown is at this point is much more than having people go out there safely, responsibly, with all the guidelines that we have and restart our economy. And that goes for our children. Now, when you say something like that, the teachers are going to come and say, well, Dr. Samadi, how about the teachers? If you are, and we love our teachers, it's very important to say that, you know, we want you to be safe, because without our teachers, there's no school, there's no education, and they're the foundation of our education, and they're the pillars. Having said that, if you are an older teacher, if you're diabetic, and if you have diabetes, obesity, heart disease, I think we should protect you, and you should be at home, and you should continue to do this distance or some form of a hybrid education where you can teach the students from home. But for the most part, a lot of the teachers between K1 and K12, they're younger, they're healthier, they're fine. And we can redesign the way our schools are set up, where now we have all these glass covers where the teachers are protected, the children are protected, we have social distancing, and rearrange our schools, but get the children back there, because without their education, they're falling behind in their education, and that's not reversible. So I'm all for it. I think we should do it safely, protect everybody, and open that. By opening up the school, you allow the parents to be able to go back to work. By going back to work, our economy starts to go, and the wheel starts to turn. And I think that's a good decision.
Well, one of the things, I wasn't going to ask you about this, but one of the things you just said kind of triggers this in my mind, because when we start talking about lockdown, we start talking about, quite frankly, a different public health crisis that we create. A lot of it is due to the stress, the duress, the mental strain of being locked down and being without your social contacts, and I think it also. I've talked to other doctors, oncologists, and other cancer specialists like yourself, who've told me that they had people that stopped getting treatment because they felt it was unsafe to go get treatment. They had people that were not going in to receive examinations,
correct,
diagnosed, and so you create a kind of this cascading public health problem correct. Over here, because you've locked this down. Can you expand on that for us? Absolutely.
I think that you're totally right, because we noticed that during this pandemic, about 90% of cancer screening went down. So we're talking about colonoscopy, mammograms, PSA screening, cervical screening, all of that by 90%. So what does that mean? A lot of people that, for example, wanted to also get their chemotherapy and radiations didn't have access to that. People that would normally will come for their prostate exam, their mammograms, they haven't been coming for months. And what's going to happen is, give it another few weeks to months, we're going to see a lot of aggressive cancers and more people from metastases and death. So the number of people that may die from like this cancer and heart disease and other screening modalities that we're not doing is going to outweigh the number of people that are going to be dying from this COVID. So that's a huge public health hazard that we need to really consider and be able to take care of them. And what I said was that this is United States of America. We need to be able to chew gum and walk at the same time. We should be able to handle this virus responsibly. Now we know so much about this virus, but at the same time, take care of all of this screening and cancer patients and cardiac disease and so on and so forth. And I think that's a big public health issue that we need to pay attention to. Absolutely.
Dr. Samadi, thanks for joining me. Your insights are so fascinating to me, and I loved reading what you have written in these areas that we've talked about today, and I love following you, and I will continue to follow you. And as long as the platforms let you have your voice heard, you're right. We've got to fight this censorship. It's too politicized. We need to be able to have open dialogue. That's what America was founded on, the notion of free speech and ideas. Thanks for all you do, and keep up the good work.
Thank you very much. A pleasure to be with you.